Hello and welcome dear students, professionals and learners to the interesting topic on dissolution testing for modified release formulations. These are also known as MR formulations and these have specific dissolution requirements and specifications. So let's start with the video. MR formulation importance. What is the importance of modified release formulations and why these formulations are made? So mainly in the modified release formulations, the release rate of the API is modified or changed. Many of the time it is made slower because compared to the immediate release dosage forms, in modified release formulations there is a lag time for release of the API, or there may be slow release of the API from the formulation over a period of certain time, which may be from around 3-4 hours to 24 hours, and that depends on the formulation and the specific indication of the API. So these formulations are mainly made to maintain the therapeutic activity for an extended time, so that the dosing frequency will be less and patient compliance can be improved. Then reducing the toxic effects. Many of the times the toxicity of the API can be reduced to a certain extent by making a modified release formulation. Then protecting the active substance against degradation in acidic pH. Because if the API get released at a faster rate, like in immediate release tablets, so it will be exposed to the acidic pH of the stomach, and that's why it may get degraded. So with the modified release formulation, the degradation of API can be decreased. Then these modified release formulations are used to target the specific part of the GIT and also for the local treatment of that part. The API get released nearby to that part or around that part of the GIT, and the API shows its local effect. Then targeting active substance release at a specified time points. So in some of the formulations, the specified time is there for the API release. So for that purpose, modified release formulations are made. Then what are the types of modified release formulations? Many of the examples are there, like prolonged release, sustained release, modified release, controlled release and extended release. So there are some minor differences between these terminologies: PR, SR, MR, CR and ER. These are based on the time up to which the formulation release the API or drug. Then coming to the formulation types based on the design. The MR formulations may be single unit, like matrix tablets, osmotic tablets, and they are non-disintegrating formulations. That's why DT test is not applied to these tablets. Like matrix tablets are there, made of HPMC or polyox polymer, and osmotic tablets. So these are non-disintegrating. Then multiple units like MUPS, multiple unit particulate system. In this pellet formulation is used and different coating is used on the pellets to have the release profile. So these pellets can be compressed into tablets. These are called as MUPS tablets, or these modified release pellets can be filled into capsules, and these are disintegrating formulations. So DT test will be there for these formulations, and these are called as disintegrating formulations. Then coming to the factors affecting dissolution, like dissolution of the IR formulations, similar factors affect the dissolution of MR formulations, which may be API related, excipients related, or manufacturing process related and batch size related. So API related, like API particle size, that is PSD, polymorphism, pH solubility profile, stability of API in the GI environment, and partition coefficient. Then excipients, effect of release controlling and non-release controlling excipients. These excipients and their critical material attributes or functionality may have the great impact on the dissolution of the modified release formulations. Then critical process parameters of the manufacturing process and batch size may have a great impact on the modified release formulation dissolution. Then some of the characteristics are there, or there is a manner of release or mechanism of release. So the modified release formulations may be membrane type or matrix type. Matrix type like HPMC matrix tablet, or membrane type means the coated tablets, and the tablets or pellets which have coating and that coating governs the release, those are called as membrane type. Then coming to the release mechanism and kinetics, the mechanism may be diffusion like in membrane types, erosion like in matrix type, osmosis like in osmotic tablets, or there may be a combination of these release mechanisms. The system formats may be single or multiple, like in previous slide we have seen single non-disintegrating unit like osmotic tablet or matrix tablet, or disintegrating tablet capsule containing multiple units of pellets. So these are disintegrating type of formulations. Then coming to the dissolution testing. See, dissolution testing is very important to show the in vivo impact and clinical and therapeutic behavior of the MR formulation, because generally the MR formulation contain higher dose and dissolution becomes much more critical when we compare the MR formulation. Dissolution is very critical for modified release formulations, and some general considerations are there. Like in immediate release formulations, we have to make a note of sink condition. Solubility characteristics and sink conditions are very much important, and also the relation to physiological environment. So GI physiological environment and sink conditions are to be considered whenever a method is being developed for dissolution. Then generally for the modified release formulations, ranges are considered in order to achieve special pharmacokinetic target profiles. The meaning of this is simple, that for a modified release formulation, the single point dissolution cannot be given, because the formulation release the API for a longer duration of time. That's why the ranges are given, and these ranges have a great impact on the Cmax and AUC of the formulation. The test duration should be such that it covers at least 80% of the dissolution, or 80% release of the API should be there within that period. Then the test medium, volume, pH and additives, these I have mentioned here, like volume of 500 to 1000 ml can be taken. pH may be from 1 to 6.8 or sometime from 1 to 7.6 with proper justification based on the formulation characteristics and API behavior. Then enzymes, salts and surfactants can be added into the media for MR formulation to have a proper sink condition. Sodium lauryl sulfate can be added up to 1%, and generally it is tried to have a lower SLS concentration. Then deaeration may be vary based on the product to product or case to case, and it is mandatory for flow through cell type of apparatus. MR formulation dissolution testing should be robust and should not get affected by the gastric and intestinal transit time. For this, multimedia dissolution testing is done. Then food effects, because many of the time the MR formulations are made to decrease the food effect, so that the food effect should not be there, and for that media pH is changed for dissolution study. Multimedia dissolution is done. Also, biorelevant media are used to test the formulation. Then different apparatus and RPM are tried to study the impact of these food effects. Pathological gastrointestinal fluid composition should not change the MR formulation dissolution in vivo, and for that volume and ionic composition of media are studied. Then concurrent alcohol intake. As the modified release formulations contain the more amount of API compared to IR formulation in some of the cases, so if there is a dose dumping due to any reason like alcohol intake, that time there may be a loss of efficacy of the formulation, or there may be a chance of toxicity due to the dose dumping, and dose dumping may happen due to this alcohol intake. So dissolution in alcoholic media is done, and different concentration of ethanol are taken into the media, like 0.1 normal HCl with 5% alcohol, 10% alcohol, 20% alcohol, and 40% alcohol as per the regulatory requirements, and this dose dumping is studied. Then why the dissolution testing is much important? See, dissolution testing is a necessary for quality assurance whenever the batches are being manufactured for the market. This dissolution testing becomes very much necessary to ensure the quality, then to ensure the batch to batch consistency, and also to indicate the consistency within the batch, that is unit to unit variation. Assurance of desired in vivo performance of the product. This in vivo performance is assured through the proper dissolution. That's why it is much important. Dissolution test can serve as a surrogate marker for in vivo behavior of the product. Dissolution also confirms consistent therapeutic performance of batches from the routine production. So this is the importance of dissolution testing. Then coming to the discriminatory power. So discriminatory power of dissolution method is the ability of the method and specification to distinguish between the good batches and the bad batches. That means the batches with acceptable release profile and the batches without acceptable release profile. So the dissolution method and specification should be able to discriminate batches with acceptable and non-acceptable release characteristics. And how we will know that which release profile is acceptable and non-acceptable? That is by including the bio study failed and past batches, and also by IVIVC establishment. So whatever the batches are passing into the bio studies, those will serve as a acceptable release batches, and those batches which failed into the dissolution studies will be non-acceptable release batches. Then discriminatory power can be proved by IVIVC, and if IVIVC is not possible with the failed batches, then average results of the pharmacokinetic parameters of the in vivo studies are taken into consideration. These are known as point estimates, and for point estimates, the Cmax, the dissolution profile in vivo, that is plasma profile, and AUC parameters are considered, and based on that the dissolution specification are set, and based on the dissolution specifications, discriminatory power is proved. Then if the IVIVC is not possible, the discriminatory power can be proved by varying the CMAs, CPPs and composition with the meaningful changes. CMAs of API like PSD, polymorphs, then CMAs of excipients like viscosity of the release controlling polymer, and CPPs of manufacturing process like tablet compression force. So these are some of the examples based on the formulation design. These CMAs, CPPs and these composition can be varied, and the discriminatory power can be proved for the dissolution method and the specification. Then how to set the specification for MR formulations? Like we have discussed that MR formulations have a release of API over a certain period of time, which may be from 4 hours, 8 hours to 24 hours. So minimum 3 points should be included in the specification. And always remember that modified release formulations have multiple dissolution specifications. So minimum 3 points are required, in which an early time point should be there, which may be 1 hour, 2 hour, 3 hour based on the MR design, and where 20 to 30% is dissolved. This time point is included to exclude the dose dumping and to characterize a loading dose or initial dose. Some of the formulations are biphasic in nature and they release around 25 to 30% dose as a loading dose. So that should be confirmed from this. Also dose dumping is confirmed from this initial time point. Then there is a middle time point where 50% is dissolved. So such time point should be selected where around 50% is dissolved. This is required to ensure the compliance with the shape of dissolution profile. That means your MR design is still working in vivo. So that middle time point is included. Then last time point, where above 80% is dissolved, that should be given a last time point. So these 3 points are the minimum. More than 3 time points can be included, like 4 or 5 time points. These are based on the criticality of the formulation and its in vivo behavior. The last time point should be such that above 80% is dissolved to ensure the most of the active substance has been released. This is much required for the complete AUC. If you consider the bioequivalency, that time if the 80% above is released, that means you will have a entire dose released within the time frame. The last point should be the time when the plateau of the dissolution has been reached. Sometimes above 80% is not achieved. That time the plateau has to be reached. Here the dissolution specification and their implications are given. First time points 1 to 2 hours with 20 to 30% to provide assurance against premature drug release. This is to prove the ER formulation design. Then around 50% to define the dissolution pattern. Then 80% to ensure almost quantitative release. And as per the FIP guidelines, 80% to be justified at least at 24 hours. And that depends on the formulation design. Now we will see the example of metformin SCL extended release tablets. Test 1 of the dissolution monograph. Dissolution test of the USP monograph. So here 1, 3 and 10 hour profile is included with 500 mg and 750 mg tablets. So you can go through this. There is a window of 20 to 40%. That means target is 30%, and to reach 30%, there is a limit of plus minus 10%. Then at 45%, the limit is 45 to 65%. This window is 20% and the center point is 55%. Then for 10 hours, it is not less than 85%. NLT 85, NLT 85. Here in 750 mg, they have mentioned 22 to 42%, 49 to 69%, and the last time point of 10 hours is not less than 85%. Then how the limits are set for dissolution and the dissolution ranges. So if you have IV-IVC, then based on the IV-IVC, the ranges can be defined. But if the IV-IVC for the formulation is not available, then based on the bio batches dissolution, the specification can be designed. Then side batches can be taken into consideration for the upper and lower limits. The range should be the difference of plus minus 10%. Thus the total difference is 20%. Like 20 to 40% release is there. So you understand that there is a 20% difference, and the middle percent release will be 30%. So 30% plus minus 10% will give you a range of 20 to 40%. Similarly, you can take an example of 50% plus minus 10%. So 40 to 60% release at certain middle time point will become the range. Here the FIP guideline is taken into consideration to show you the side batches. So this is your target batch, which is passing into the bioequivalence criteria. Then you have made a lower release batch and a higher release batch. So based on these side batches with lower and higher release to the target batch, we can give the specification limits. Then if we don't have a side batches, then based on the dissolution similarity factor of 50%, 50 dissolution similarity factor up to 50, we can give a 10% limit. So based on this, 10% limit can be given to the specification. If you have IV-IVC in place, then you can give wider ranges, difference of more than 10%. Why? Because you have established IV-IVC, and in IV-IVC, the entire plasma concentration time profile is calculated for the proposed upper and lower dissolution limits, and based on the observed in vitro dissolution data for the to be marketed batch, that is reference batch or reference formulation, utilizing the validated IV-IVC. So you understand from the IV-IVC that at or up to which dissolution specification range the product will be bioequivalent to the reference product, and based on that the limits can be widened. The corresponding Cmass and the selected AUC parameter values are calculated for the proposed lower and upper limits, and the reference formulation and ratios calculated for upper to lower, then lower to reference and upper to reference. So based on this upper and lower dissolution ranges can be designed. Then once you have a dissolution in hand, dissolution method you have, dissolution specification you have proved the discriminatory power of the dissolution, then for routine production you should have a control strategy to control these variables which have impact on the dissolution. The control strategy for dissolution involves controlling the factors which affect dissolution behavior of the product. and critical quality attributes for the control of drug release. So in control strategy, you can include whatever the CMAs, CPPs and other characteristics or any other conditions like storage condition or in process condition, whatever was studied and has shown impact on the dissolution, those all points should be controlled through a well defined control strategy, so that you will have assurance that the formulation will meet the dissolution specification when it is in the routine production. And always remember that the dissolution discriminatory power should be proved onto the QC release method. That method should not be over discriminatory or under discriminatory. And always we should give the dissolution specification based on the bio batch and the side batches. If there is a established IVIVC, then that established IVIVC will serve as a base for the dissolution specification. So this is regarding the MR formulation dissolution specification and the other information. I hope you might have liked this video and you will be able to learn the dissolution for MR formulations from this video. If you don't understand any of the thing, you can rewind the video many times and you can understand. For making this video, I have referred USP guideline, EMA guideline and US FDA guidance. Then also the figures are taken from the review article named as Dissolution Test for ER products from these scientists. This is the very old paper and this is one of the best paper to refer for dissolution specification for MR formulations. Also note that always for a MR formulation, the zero order release cannot be achieved and first order also can suffice the requirement. So mainly the first order and zero order release kinetics are there with the MR formulations. So in summary, we have studied the dissolution requirements, dissolution specifications for modified release formulations and also understood the best practices. Please do like, share and subscribe to the video and also read these guidelines to have in-depth understanding. Thanks for watching the video.